concussions is a big deal, and right now it's fall in Montana, which means like football, soccer, we're getting ready for volleyball, ski season's maybe around the corner if we're lucky. So about every 4 years, the International Society for Sports Medicine and Concussions, they all get together in Amsterdam, and they host a huge international conference. And they just hosted the 6th one back in 2022, which is a year too late because of the pandemic. But they just released their new concussion statement earlier, like a couple months ago, I think. So anyways, I thought, it was a cool subject. It's kind of hot on the market. So I gathered my favorite healthcare providers together. And so we'll talk a little bit about like where concussions are currently, the big, huge danger signs that are going on with concussions, how like if your kid gets hit at practice, like what's a 911 visit to go see Todd in urgent care, or what's like wait till Amy opens up on Monday morning. So hopefully that helps. So kind of some cool new stats that were just released with this consensus statement was that if hockey players wear a mouth guard, it decreases their rate of concussions by 28%. So that's pretty cool. So if kids are going out for hockey, like wear a mouth guard, do not forget it. The other cool thing that just came out, that for American football, they've set some new policies and rules in place, which are to limit the number of contact practices and to decrease the duration of their practices. And if they're able to do that and follow those rules, it decreases your rate of a concussion by 64% for concussion-related practices. So that's pretty incredible, I think. So the moral of that story is that the International Society is always moving, changing, doing better research to figure out what's going on with concussions, and that's what our job is today, is just get everybody up to speed with what's going on, because we don't always have an athletic trainer at each event. So they might have, for a little Grizz football, one athletic trainer for like 15 fields that are going at the same time, and at the high school level, they usually have athletic trainers, but not for every practice. So I'll just do some introductions and then we'll get started. So, all right, so this is Dr. Marissa Cavalier. So she just drove down from Missoula, Montana. She is a naturopath. The big city. So she works a lot with like post-concussion stuff. So naturopaths, you're looking at a little bit more like related into food and, supplements and stuff like that, which is a big deal. I don't know, you're a mom of 2 super active boys and lived in Missoula for 15 plus years, I think.
Yeah.
So anyways, so she works at Aralia Health up in Missoula, so super great. This is Todd. So Todd is a nurse practitioner, so he actually runs the new urgent care clinic out at Bitterroot Health on the highway. So, so he's like our go-to guy, like, oh my gosh, something happened to Johnny. Like, you just go take him to Todd. So, exactly. So, so Todd's great. I've known him for quite some time. You're from Butte, America, originally, I believe. And Todd has really helped me get over my fear of needles, on a fun side note. So, all right, and then we've got Grace Carmen. So she just moved here like 2018-ish from upstate New York.
Western.
Okay.
Yeah, that's even better. Yeah.
Okay. Western New York. So she's an occupational therapist, and she also has a specialty in doing visual therapy, which I knew nothing about until she came and talked to me about it, which has a lot to do with rehabbing from stroke, TBIs, post-concussion syndrome, and so it's been fun working with her on a few of my really hard cases. So and then me, I'll introduce myself, so Dr. Amy Berglund. So sports chiropractor here, so I do a ton of rehab with concussion, and I travel a little bit with Team USA. And so anyways, so we'll get started. So Marissa's gonna start off.
Yeah. So we're just gonna kind of do some basic nuts and bolts. Like, what is a concussion? Do you guys know?
It's a trauma to the brain.
Yeah, exactly. It's a form of a traumatic brain injury. It can be caused by like an actual hit to the head, a head hitting the floor, but also it can be just, a hit to the body that causes the head to kind of, the brain to move inside the head. So, you always think like you have to actually hit your head to get a traumatic brain injury, and that is definitely not the case. And so, a lot of that kind of, so depending on how the hit happens, the force of the impact, the direction that it's happening, it can cause different reactions inside of the brain. So it can either cause like axonal injuries, which is, you have like your neuron and then your axon. So you can have like tearing of axons. You can actually have, you can have bleeding, you can have skull fractures, concussions, contusions. The end result typically is always some kind of inflammation in the brain, right? So there's always this end result of kind of a big inflammation in the brain. And then you can have what's considered like a primary injury. So the primary injury is what happens from the actual impact. And then you can have a secondary injury, which is typically what happens, kind of a downstream effect from that inflammation in the brain. And so there's a couple different, signs and symptoms. There are certain signs that you will observe when you're looking at a person who has just had a brain injury. A lot of times there can be, confusion about where they are in place and time. They can look kind of dazed, confused. They might forget kind of like where they are, what they're doing. They can have sort of awkward movements. They can answer questions slowly. They can lose consciousness. They don't have to. And they can also have some like mood and behavior changes. And then you can also have the symptoms that they will tell you that they're experiencing. So these are things that you might observe in someone who's just had concussion. But they can also, complain of a headache, pressure in the head, nausea, vomiting. They can have, balance problems, dizziness. They can be bothered by light, noise, any kind of like external stimuli. And then a lot of times there can just be, brain fog, sluggishness. They can't really think, they can't process. They're not thinking clearly. They might just say they don't feel right, but they can't quite put their finger on what it is. There can be sleep changes, mood changes, behavior changes. It can kind of cross the whole gamut. A lot of times what you'll see initially is some of those physical symptoms. So like headache, dizziness, nausea, vomiting, kind of that confusion. And then those can sometimes go away. And then what you'll start to see is sometimes those like mental emotional symptoms coming up, where they might feel down or depressed, or they're not thinking clearly. And so sometimes it can be more the physical, and then it moves into some of that mental emotional kind of picture.
So on that, they always used to check the eyeballs.
Yes.
So is that still a thing?
It is the thing.
Okay.
Yep.
Okay.
Yep, exactly. So there's a lot of testing that will happen. I think you're probably going to go into some of like the details of exactly what that looks like, but they check your eyes, they're going to check your balance. There's a whole neurological exam that they'll do. Yep.
All right, Todd, you want to take it away?
Sure.
Okay.
All right, so responding to the concussion that's occurring. So I think pre-concussion is something to talk about first, right? What we're doing before the concussions. And those are making it okay for the student or the athlete to say, I'm out. The student has got to feel okay going up to the coach and say, that rung my bell, I got to be out. Okay, and the coach, so the other piece of that is to kind of expect. You've got to expect that those complaints are going to come. Yeah, there's some that I'm too tired today, I don't want to play. I think coaches do a pretty good job of sussing that out. But somebody takes a bell ringer and it's like, they want out, let them out. Okay, they need to let their brains be down. Ask your athletes, do they know the symptoms? They probably don't. So there's a huge list. We have lots of handout kinds of things and resources to give you. Have the athlete review what those symptoms are so that they know themselves, I didn't know that was concussion related. So that when they see that come on to themselves, they can report that. Another pre-concussion kind of thing, coaches, wasn't until I did all of this, realizing there's state laws about what they have to be trained in, who has to report, kids have to come out, those kinds of things. Coach should be up for that. Your coaches should be willing to hear the kids come to them and say, hey. So it's one thing for the kid to have the guts to come up, the other for the coach to say, I got you. Take a seat, it's good for that. And then coaches